This video is for the woman or couple who have been trying to conceive longer than they expected and wondering what is keeping them from a positive pregnancy test. Maybe you've even been going through a fertility clinic and treatments and it's still not working, which is unfortunately common for reasons I'm going to get into in this video. I'm Dr. Mimi. I'm a perinatal chiropractor, Mercier therapist, and functional medicine doctor in training. And I help couples optimize their health and fertility naturally through a root cause, whole body approach. We look upstream at the factors impacting function. And this is actually my first YouTube video. So if you're watching, thank you and welcome. My goal with this channel is to help you understand your body and your fertility on a deeper level. I want to teach you how the body works, what can both significantly and quietly interfere with fertility, and how to identify and address those upstream factors through a whole body root cause approach. Whether you're trying to conceive naturally, preparing for IVF, or just want to optimize your health before pregnancy, this information is for you. So today I'm going to start off by talking about the top 7, things that I find and work on with clients struggling with fertility. And I'll have to make a separate video for recurrent loss. That's a little more specific. But I find these things with both couples who are struggling to get pregnant and couples who are struggling to stay pregnant. Now, before we get into this, I want to mention, when you think about the conventional fertility approach, it's almost all centered on treating the downstream effects. If you can't get pregnant, the answer is often IUI, IVF, taking steps away to get egg and sperm together. If you can't ovulate, the answer is often medication like Clomid or Letrozole that induces ovulation. For the most part, in most fertility clinics, there really is no question of the upstream causes. And if we can identify those, that's where the power is. So that's what I'm looking for as a functional provider, the upstream drivers, with a focus on your health, because it's all connected. And that's where we see optimal results, when health is the focus, health and function is the focus of your fertility. So here we go. Number 1 most common obstacle I see from a very general logical standpoint. If you just chat GPT, what nutrients are essential for egg and sperm development? There's a list. I mean, you literally need certain nutrients for cell division and the biochemical processes involved in egg and sperm production. If you're low or insufficient in those nutrients, which I do test for some of them and often find, can that impact your egg and sperm quality? Of course it can. If I say, hey, build a house, but then I don't give you all of the material or building blocks, that's not going to work out well, is it? So your micronutrients, but also macronutrients, like I often find women and men, but more commonly women, I often find you're not eating enough, not fueling your body enough. That's not everyone, but it is a common observation. Or at least not eating enough of the right nourishing foods. I do see this in men too, and particularly with antioxidants like your fruits and vegetables. This is so important for sperm health. And if you just count how many fruits and vegetables you eat in a day and it's less than 5, that's a problem for a lot of reasons. And unfortunately, it's not just about what you're eating, it's what you're absorbing. So for many people, we have to work on gut health. And these are things we can, to some extent, identify through blood work, as well as, of course, other advanced testing if needed, like a stool test we love, and always a comprehensive history, lifestyle, diet assessment. There can be many factors affecting your gut health and absorption. This is why working with a provider who is trained functionally and understands how the body works is important, because sometimes you need more support than just making healthier food choices. Nutrients are the building blocks your body needs to function. Yes, they're important for egg and sperm development, but they're also essential for systems that support fertility. For example, iron is critical for carrying oxygen to your tissues, including your reproductive organs. It's also important for energy. Vitamin D helps regulate the immune system and supports healthy mitochondrial function and progesterone production. Vitamin B12 is essential for energy production, DNA synthesis, pretty important, healthy cell division as well. Magnesium supports your nervous system and is involved in hundreds of biochemical reactions throughout the body. I do test for most of these nutrients and often find they are low or at least suboptimal. Next is stress. Stress is a huge driver of health issues. And, I want to acknowledge that the stress response is not inherently bad. It's necessary, it's life-saving, It's the chronic, prolonged stress that is going to impact your health and fertility. If you've heard the term fight or flight, that refers to your stress response. And while that response is normal and protective in the short term, the problem is when stress becomes chronic and cortisol stays elevated for too long. When that happens, it can affect blood sugar, increase systemic inflammation, contribute to hormone imbalance, and it can impact reproduction in a lot of ways, including egg and sperm quality, nutrient availability, cycle health, ovulation. This is all happening through the autonomic nervous system, which controls the functions you do not consciously think about, like your heart rate, digestion, blood pressure, even reproductive function. You don't have to think about, oh, what am I going to develop next as I'm pregnant, growing a new baby? The autonomic nervous system has two main branches: the sympathetic nervous system, which drives fight or flight, and the parasympathetic nervous system, which supports rest, digestion, healing, reproduction. These two branches work like a seesaw. So when one is overactive, the other one is suppressed. So if the sympathetic nervous system stays dominant because of chronic stress, the brain prioritizes survival over reproduction. That means less optimal communication, blood flow, and nerve signaling to the reproductive organs, which can, of course, affect fertility. This is why nervous system health matters so much, and chiropractic care can be so helpful because it supports nervous system regulation and improves adaptability to stress. You can't delete all stress, but you can support your nervous system and stress resilience, and chiropractic is one of the most, if not the most powerful ways to do this. That's the reason why many patients say things like they notice improvement in their digestion and sleep when under chiropractic care without changing anything else, because those are parasympathetic functions, and that's what we support. So stress has got to be addressed, and nervous system support is essential, and we see amazing results when we focus on this. You can do all the other things, but if your nervous system is dysregulated, it's not going to work as well, if at all. Your nervous system coordinates all other systems. That's where nervous system-based chiropractic comes into play. Big time, can be a total game changer. So number 3 is a huge missing link in fertility cases, and that's lack of mobility and blood flow of the reproductive organs. I've actually had women come in and tell me that their doctor told them they don't have good blood flow, and that's why they can't get or stay pregnant. Then the answer or solution provided is IVF. There's again a downstream treatment. Why don't we address the upstream cause, the blood flow? Blood is everything. It's so important. Without blood flow, you don't get your nutrients and oxygen. All tissues need those things to thrive. And just to touch on nervous system once more, when you're stressed and that sympathetic nervous system is activated, your brain shuts down blood and nerve flow to the reproductive organs. So getting adjusted helps restore that communication and flow, but also we can check your pelvic function, and that's what Mercier therapy focuses on. Mercier therapy is 6 one-hour sessions of manual therapy to the reproductive organs. It's manipulation, all external, of the uterus and ovaries and the surrounding structures to restore mobility and blood flow. And this is so important and such a vital missing piece. This is a foundation. And honestly, this very well may be the missing link in your fertility journey. I see it a lot, especially in women with endometriosis or PCOS or unexplained infertility, and women who really are doing everything right. A lot of times I have women come in thinking they've done all the things, but their lifestyle and environment foundations really aren't laid and strong, so we work on that too. But I do often get women whose labs are clean. They're really truly doing all of these amazing things. Maybe there's some little tweaks we need to make and some other small changes, but then we'll find this lack of mobility and blood flow to the reproductive organs. And when we work on that and restore optimal pelvic function, that's what the goal is with Mercier therapy. It's about optimizing your pelvic function, mobility, and blood flow. When we do that, things happen, and many times quickly. I'm talking within a few months, if that, of starting this work, there's a positive test, or the next pregnancy is the one that sticks for women experiencing recurrent loss. Pelvic function is so important. That's where the magic is happening. Of course it matters. To me, it's like, why don't we check pelvic function on every woman before she conceives or tries to conceive? This is something that I think really needs to be more emphasized and has totally transformed our outcomes at my practice. And the studies speak for themselves. 3 studies done on Mircea therapy have shown 83 to 87% success rate for pregnancy in a year. When I learned about that, I immediately signed up to get certified because that's amazing. Next, one of the most common things I find and work on is metabolic dysfunction. So blood sugar dysregulation, driving insulin resistance. And I have a whole video on insulin resistance. It is so common, up to 1 in 3 Americans have it. So if you really want to learn more, watch that video where I go in more in depth. But insulin resistance can affect all aspects of fertility: ovulation, egg and sperm quality, implantation, endometrial receptivity, embryo quality, risk of miscarriage, and even pregnancy outcomes, complications like gestational diabetes, preeclampsia. All of these things, insulin resistance increases risk for. It can cause hormonal imbalance. It can drive up estrogen in women and progesterone down. And for men, insulin can drive testosterone down. Insulin resistance drives inflammation and oxidative stress. These mechanisms have a ripple effect on all systems and impact your egg and sperm quality and can literally damage these cells. I do have another video on oxidative stress, by the way, if you want to learn more. I find it really fascinating how it can impact egg and sperm quality. But here's the kicker with insulin. It can be elevated, causing issues well before an HbA1c or glucose reading on blood work elevates. And most doctors don't check it. Literally 2 days ago, I got blood work back for a woman who's experiencing recurrent loss, and she was told her next step is IVF. I ran her blood work, and we found HbA1c and glucose were normal, and her insulin was elevated at 14. Ideal is under 5. No one had checked her insulin. We also found some other things that can impact egg quality and inflammation, but my point here is this is really common, and again, it can impact all areas of reproduction. And most providers aren't checking specifically for insulin. Insulin levels can be elevated and causing issues for years before your glucose or your HbA1c get flagged. And not only is insulin not being checked, it's not being addressed in a root cause way either. If blood sugar dysregulation is discovered, usually something like metformin is prescribed. And while it can be helpful, there is side effects, and it doesn't always work. And it doesn't address the upstream drivers of the dysfunction in the first place, which food is big, but it's not the only thing that affects blood sugar. So a comprehensive approach is necessary here. And I'm not saying that metformin is bad and you shouldn't be taking it, but I think it's important to understand that it's not always correcting the issue. I had a woman who was on metformin for a year and her insulin was 50 still, which nobody ever checked. So was the metformin really working? And there are side effects to be aware of, and it's not addressing the lifestyle and environment factors that are driving the blood sugar dysregulation. So it's important to acknowledge that. Can it be a tool? Yes, but it's just important to be aware of these things. Another common obstacle I find is, and I mentioned nutrients and absorption earlier, which kind of alluded to this next part. So I touched on how gut function can impact nutrient absorption, which is definitely essential for fertility, right? But there's so much more to the story. What happens in the gut doesn't stay in the gut. And you don't have to have gut symptoms like abdominal discomfort, gas, bloating, constipation, diarrhea, acid reflux, all of those really fun symptoms. While they can be indicative of gut dysfunction, you don't have to have gut-specific symptoms to have gut dysfunction. And this can drive chronic inflammation and immune activation, which can both play a major role in fertility. Gut dysfunction can result in interference with hormone signaling and metabolism, so clearing estrogen. It can disrupt the menstrual cycle and influence ovulation. It can impact egg and sperm quality, and it can play a role or contribute to other conditions like endometriosis, PCOS, hypothyroidism, to name a few. It's all connected, I'm telling you. So we have to check all of these areas if we want optimal results. And restoring gut integrity is so foundational. I usually start with an assessment, and even comprehensive blood work can give us clues into what's going on in the gut. So I usually start there. I let the patient's history, presentation, lifestyle, environment kind of guide where we go from there. But I do love a gut test, a stool analysis, to get more specific. As I mentioned the gut and its connection with immune system, you might have thought, well, Can immune system dysfunction or activation, is that another common driver? And it can be. And while I don't think that this is one of the most common obstacles I see, which this video is about, it's definitely a common one. So I'm not going to get into immune dysfunction here. I will make another video on it though, because it's super important. This video is on the most common patterns or obstacles that I see in practice. So I see these things I'm mentioning and talking about a lot, which brings me to the last point. The most common obstacle, I don't know, is this number 7? I think this is number 7. We didn't look deep enough at dad. We didn't support dad enough. He had a sperm analysis once and it was fine. Then sometimes I'll look at his numbers and they're not optimal. They're far from it. He didn't even have a DNA fragmentation checked and no testing beyond that. Just the one sperm analysis and he's cleared, good to go. We do in-depth testing and we're looking for optimal, not just barely passing conventional levels, conventionally normal. And all of the previous things I mentioned here, except of course, mobility of the uterus and surrounding structures, that doesn't apply to him. But all the other things I mentioned, we check on: nutrition, metabolism, inflammation, nervous system. All of these things can impact his hormones and his sperm quality too. I very often find that men can use improvement in their health and fertility. And men tend to hold their stress differently. That doesn't mean it's not affecting their body. Men can have a lot of stress too. So we got to support their nervous system. Remember, if your body is always in stress mode, it's going to prioritize survival over reproduction. That goes for both partners. So many times a couple comes in and the male isn't even taking any supplements. And this is just crazy to me based on my knowledge and training. And I talk through every one of my clients on nutrition and diet. And when I list the highest sources of some foods that are crucial for fertility, I find so many men and women, but we're talking about men here, are rarely eating many of them. Regularly at that. You should be eating these foods regularly. Oftentimes the woman has her stuff dialed in and she's got her supplement regimen and she's been doing, all these amazing, wonderful things. And the male is like taking creatine and that's it, because he had a sperm analysis and it was fine. We got to support men better. And a sperm analysis can look completely different in less than 3 months, which is awesome. We just need to know what to do to improve it. And supplements are only a piece of that. But we can change sperm parameters through lifestyle and environment. There are so many studies that support this. And even if dad is pretty healthy, there's usually areas I find we can optimize. With my patients and clients, we do comprehensive labs on both partners. So you can both understand where you're at and where you may need support. It is 50-50 and we got to start acting like it. We got to start giving men more in-depth assessment and support. So that's the final one. I often find that we need to look at dad more and support dad better. And I do often find couples or people with multiple or even all 6 of these things going on. It's not uncommon that we're working on all the above and more. So supporting fertility goes so much further beyond procedures to get egg and sperm together and help you get pregnant. The preconception work you do before can totally transform your life and your outcomes. I hope this was helpful. This doesn't encompass everything I find, but again, for majority of couples I work with, a combination of these things are showing up and they don't get caught or addressed fully on a conventional workup. That's not to say a conventional workup is useless. It's not, but they're just not looking at things from a holistic whole body approach. If you want to know the most common things I find on blood work for my fertility couples, subscribe so you don't miss the next video on that. And if you want to have a comprehensive root cause approach, I'll leave the link for options to work with me in the caption and for the next topic once it's live. Thank you for watching. Let me know if you thought this was helpful, if you have any questions or anything else you'd like me to go over. I am here for you. I want to help you understand this whole fertility thing and get to the bottom of your issues and optimize your health and fertility. So make sure you like and subscribe so you don't miss more education, and share this video with those who need it. Thanks.